The CDC is making it easier for people to get a different kind of protection, approving the first ever self-administered flu vaccine, a nasal spray that can be done at home. FluMist is designed to be administered by either the recipient or caregiver, but of course, people are wondering, is it as effective as it would be to get the flu vaccine? Dr. Reena Mehta with Uptown Allergy and Asthma joins us to explain. Dr. Mehta, good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
So I know we heard that this was in production. This would soon be a possibility, but talk about this FluMist. How does this work exactly?
Okay, so that's a great question. So FluMist is a nasal vaccine. So it is a vaccine. It is just like getting the flu shot, but it doesn't have to be a shot. You can actually administer the vaccine through your nose. Now, the difference between the FluMist and the flu shot is the FluMist is considered a live vaccine. And so there's certain restrictions on who can receive it. However, it is thought to be just as effective as the flu vaccine. The difference is the flu vaccine is not a live vaccine.
So that's like the dead virus, as people often hear that term used. So I know people at home are thinking, I have hated shots since I can remember. I want this. But you just said this is not going to be for everyone, and you can't just go out and buy this over the counter. Is that right?
So FluMist has actually been around since 2003. Okay. It got pulled off the market in 2016 because there was questions about whether it was as effective. And then AstraZeneca reformulated it, and in 2018 it came back out, and now it is available for home administration. It's the first flu vaccine that is available to do at home. So you don't have to go to your doctor's office or a healthcare facility or a pharmacy to actually get it. So the way that it works is that if you are interested in getting it, you go to the FluMist website, and they'll put you in touch with a third-party pharmacy. The pharmacy will kind of go through an intake form to see whether you are a good candidate for it, and if you are, then they'll mail it to your house, and you can do it yourself.
Now, most people who get the standard flu shot every year, their insurance covers it, or sometimes they're free. Is that the case with this one?
That is the hope as well, that the insurance would cover it. Now, there are some restrictions, as I mentioned. So it is for ages 2 to 49 years of age.
Okay.
So we are not giving this to our babies. We are not giving this to our elderly and those that are immunocompromised or pregnant, because again, it's a live vaccine. And so the thought is that if your body can't handle that immunologic response, then it could potentially create some harm. And so we're going for ages 2 to 49. If you're otherwise healthy, you are a good candidate for the FluMist, and then you can actually do it at home.
This is incredible. A game changer, one might even say, that you could do this spray at home if you are in that category. Let's talk side effects, because with the flu shot, you might sometimes feel that arm tenderness, but that's a dead-end virus in that shot. With this live virus in the spray, let's talk the differences in side effects.
Okay, great question. So it's not suggesting that it's going to be worse getting the the nasal vaccine. They use it a lot in Europe. So again, this is like not a new thing, this FluMist. It's just now available for people in the United States to do it at home. So we do have lots of data on side effects. Basically, your most common ones will be anything that you would expect with a normal shot. So like maybe a little bit of feverish, maybe a sore throat, a little bit of headache or nasal congestion, but usually that lasts like a day or two and then gone.
Can you get that nasal spray, and then if you want to go get your COVID vaccine at a clinic, at your doctor's office, at a pharmacy, can you get both of those at the same time?
Absolutely, absolutely. So this is just making it more available for people who otherwise can't take time off work, or don't like shots, or don't want to go somewhere to go get it, but yet still want to be vaccinated against the flu, because again, it is a pretty effective way to at least decrease the risk of getting the flu, or if you're going to get the flu, it's going to make you much less sick with it. It works.
Dr. Mehta, lastly, because we have a couple seconds left, I know people at home are like, I am very interested in this. I fall in that category, and again, I hate shots. What do they search, or what do they Google to find this?
So this is through AstraZeneca. So you can go to the AstraZeneca website, or you can even go to the FluMist website, and then you can go through that, and they will give you instructions on their website to show how to see whether, one, you're a candidate, and two, how to get in touch with a pharmacy to see whether you truly are eligible for this vaccine, and then they'll mail it to your house.
It sounds so easy. Well, Dr. Mehta, thank you so much for telling us about this new option for people who, again, want to be protected from the flu but cannot stand shots and fall into this category. We appreciate your time so much this morning.
Thank you so much for having me.